In case you haven't heard, it's officially in Abercrombie summer. The A&F Vacation Shop has everything on your packing mood board. I desperately need their new one piece, the A&F Marina. It's strapless, so flattering, and paired with denim shorts will be my go-to beach outfit this summer. Finally, your suitcase isn't complete without finding that dress. You know, the one for the photo shoot. Abercrombie's boho dresses have that perfect beachy, romantic look. Make it an Abercrombie summer. Shop their newest arrivals in-store, online, and in the app.
With a Venmo debit card, you can Venmo more than just your friends. You can use your balance in so many ways. You can Venmo everything. Need gas? You can Venmo this. How about snacks? You can Venmo that. Your favorite band's merch? You can Venmo this. Or their next show? You can Venmo that. Visit venmo.me/debit to learn more.
You can Venmo this, or you can Venmo that. You can Venmo this, or you can Venmo that. You can Venmo.
The Venmo MasterCard is issued by the Bancorp Bank N.A. pursuant to license by MasterCard International Incorporated. Card may be used everywhere MasterCard is accepted. Venmo purchase restrictions apply.
I'm Dr. Wendy Hunter, and I'm the pediatrician next door. I'm that doctor friend you call for practical advice about your kid's health. I mix the science of medicine with the reality of parenting. I'm joined once again by psychiatrist Dr. Julia Krankl for an honest conversation that I know many parents have been waiting for. It's the role of medication in children's mental health. Let me start with what I've seen in clinic. When a child is struggling with anxiety or depression, most parents do not want to jump to medication. They want to know what else they can try first, like therapy or coaching. And yes, those things do matter. They really matter. In fact, lifestyle changes and talk therapy are the foundation of mental health care for kids. But sometimes that's not enough. That's when we start talking about medication. And the most commonly prescribed are the SSRIs, or selective serotonin reuptake inhibitors. That's medications like fluoxetine, which is Prozac, and sertraline, which is Zoloft. These medications have been shown in multiple large studies to be safe and effective in children and teens when they're used appropriately. In fact, the truth is, the earlier you intervene, the earlier you use these medications, especially in cases of moderate or severe anxiety or depression, the better the long-term outcome is for the child. And most of them don't need the medication later in life. That said, SSRIs are not a magic bullet. They take a long time to work. Often they can take 4 to 6 weeks. And it's going to take a few tries to find the right dose or even the right medication. Parents should expect that they're going to need to make frequent follow-up appointments because kids can have some side effects. We like to check on them. Things like headaches, upset stomach, sleep changes, or sometimes, very rarely, they can have behavioral activation where they get more restless or irritable. And that's why we start at a very low dose and we increase very slowly. That's standard practice. What's important to remember is that medication is not about fixing your child. It's about taking away barriers so that the therapy is more effective, so that school feels more manageable, and so they can just start to feel a little bit more like themselves. And as a parent, it's normal for you to wonder, how do I know if my child really needs medication? Are they going to need it forever? And that's where today's conversation starts, with the question, how do we find the balance? The balance between supporting a child's mental health with all the tools that are available and the use of medications, between waiting it out and acting early, between stigma and empowerment. Here's my conversation with Dr. Julia Krankl. Can you speak to the role or your philosophy of medication in treating anxiety and depression? And really just, your philosophy. When would you start? Why would you start?
Well, that's a good question. So I work with adults, not kids, so I'll kind of come from that perspective. But I really drive it based on what the patient wants. So, one of the most important questions that I ask of my patients is, what are your goals for treatment? And I think it's really important right away to ask that, because it's, we are our patient's cheerleader, right? We're there to help them meet their goals, not our own goals. Mm-hmm. And so when I see someone, I always ask them that. And I always ask them, do you want to take medication, or would you prefer non-medication approaches? So I get that sense from them right away. And I think the biggest reason to start a medication is, again, if the symptoms are impairing someone's functioning, right? So if they're experiencing anxiety or depression and it's impairing their functioning, that's a really good reason to talk with their doctor and to consider medication. I have a lot of patients who say, I think I need a medication right now because things are not going well. Like this is a crisis. Things are not going well. And I've tried X, Y, or Z and I'm not making enough progress. But my end goal is to be off medication. I have a lot of patients who tell me that. And so then I think it's really important to walk with them, in using a medication and then helping build up those non-medication coping skills along the way so that they can meet their end goal of getting off of medications. Now, I have other people who take medication and they find that it allows them to be the best version of themselves. So they say, I feel like the real me when I take a medication for anxiety or depression. And that's so powerful and important, right? For someone to feel like they can be the best version of themselves. And so for those folks, a lot of times they're like, I never want to go off of medication, right? Like this is allowing me to be the best version of me. Like I have no interest whatsoever in going off of medication. And that's okay too. So really for me, I think it's that individual conversation, between doctor and patient that's so important to decide. And it has to be in line with the patient's values. They have to feel like it's the right thing for them. So I think never pushing medication is really important. We can say this could really be helpful, but ultimately it's their choice to make. So I feel like I'm there to offer the solution that the patient is looking for on that individual basis.
So how do you find the balance? You work together. That's the answer. You work with your child, their doctor, their therapist, everyone on the same team. You make decisions based on what's best for your child. And that might mean medication. It might mean therapy. It might mean both. And it almost always means checking in often and adjusting as you go and staying open to options. There's no one-size-fits-all solution when it comes to kids' mental health. But what matters most is that your child feels like you are supporting them, that they feel understood, and that they don't feel alone in what they're going through. Thank you for being here for this conversation. If you found it helpful, please share it with another parent who might be facing these same questions. For more from the Pediatrician Next Door, find me on the web at pediatriciannextdoorpodcast.com. If you've got a question about the weird things kids do, send an email to hello@pediatriciannextdoorpodcast.com for a chance to hear your voice on the show. I'm Dr. Wendy Hunter, and I'm the Pediatrician Next Door. This show is produced by Red Rock Music. Make sure to subscribe and leave a review wherever it is you're listening. I'll be back next time with more.